Hello again, this is Jonathan Wright, Dr. Wright from the Tahoma Clinic. Going to be going over today is Osgood-Schlatter Disease. What is Osgood-Schlatter Disease and how the heck do you spell it? Well, it's Osgood-Schlatters, named after two doctors who wrote us some information about this quite a long time ago. They didn't have the disease, but that's what it's called. Well, what is it? I'm sorry. I realize if you're watching this, you probably know already and have been searching around for information on Osgood-Schlatter disease. But for those few who don't know, it is an inflammation of the bone called the tibia, right where it comes up close to the kneecap. And if we all reach past our knees, our kneecaps that is, to the next bone and feel there, we'll feel, yeah, there's a little protrusion of the bone of the leg, the lower leg, called the tibia, where it comes close to the kneecap. Okay, that one is called, and I'm sorry about all the medicalese, it's called the tibial tubercle. All right, well, it gets inflamed in particularly older children and teenagers. What's an older children? 11 years old, 12 years old, 13 years old, and younger teenagers, those who aren't yet 16, 17, 18. Why does it get inflamed? Well, no one knows, but when it gets inflamed, it hurts, and you can't play soccer so well because your tibial tubercle is hurting, and you can't play basketball. And what do? Well, sometimes you're told if you have Osgood-Schlatter disease, you've got to quit playing sports until it gets better. And sometimes there are things done such as putting a cast on there so that you can't bump it, and other physical therapy measures. And sometimes it does go away fairly rapidly, but fairly often it lasts, and that pain hurts, and we can't get out there and run like we want to run, especially if we're that age. We can't because it's hurting too much. Well, there isn't any published so-called literature, but a number of years ago, my goodness, must be back in the 1970s or 80s, somehow I tripped over a remedy for this problem that has worked in nearly every child and teenager that's tried it. And it's safe, too, which is even better. What is it? Two things. Selenium, the mineral selenium. 200 micrograms per day. That's safe even in an 11 or 12-year-old, and it's particularly safe if we're bigger than that. Selenium overdoses don't usually happen at that age until we get past perhaps 1,200 to 2,000 micrograms. So 200 micrograms a day, and 400 units of vitamin E as mixed tocopherols. That usually comes in one capsule, and we take one of those a day and a selenium capsule once a day. And back at that time, I would receive letters and the occasional phone call from particularly soccer coaches and basketball coaches, as well as from parents, saying that they'd read that in a publication I previously wrote for, and they tried it for their kids, especially since it wasn't harmful, and it worked. A few weeks, at most a couple of months, and the Osgood-Schlatter disease was gone and it never did come back. And I've even worked with adults, 40, 50 years of age, who when they were kids had Osgood-Schlatter disease, and what do you know, when we tested them, they're still low on selenium, or they just tried it because they had the problem when they were kids, so they thought they would see what it would do for them today. And what do you know, it's done something else good for them. So, is it a deficiency of selenium, or is it some problem that creates a need for more selenium? Now remember, it's selenium and vitamin E, the mixed tocopherol form. That's a very specific form. Ask your health food store if you don't, or your compounding pharmacy or the Tahoma Clinic dispensary. Ask them what that is, the mixed tocopherols, if you don't know. But it's 4 tocopherols all put together. One of those, 400 units a day, very safe for a child, a teenager. 200 micrograms of selenium. So, anyway, folks, that's it for Osgood-Schlatter disease. What you can do about it, good luck.